Good morning, everyone. Bonjour tout le monde. Merci d'être avec nous aujourd'hui. Very hopefully briefly today, I wanted to draw attention to the G7 summit. Je voulais discuter le sommet des pays du G7. En fait, le sommet du G7, à mon avis, et l'avis de notre parti, s'est converti dans un sommet global sur l'état de la vaccination, des efforts de vaccination globale. Et on dit que maintenant, c'est le moment de vérité. C'est le moment pour les pays les plus riches avec les plus de vaccins de livrer des résultats pour les pays de faible revenu, les pays de moyen revenu. En fait, le COVAX, qui est l'initiative globale pour partager les vaccins, qui était établie par une alliance d'associations de santé, a sonné l'alarme. Ils ont dit clairement que la vague de virus en Inde a affecté sévèrement l'approvisionnement des vaccins dans le deuxième quart de cette année. Et que d'ici le fin juin, que le COVAX va avoir un déficit de 190 millions de doses. Et si on n'adresse pas la situation actuelle d'une manière urgente, que les conséquences vont être catastrophiques. On sait qu'en Afrique, seulement 2% des gens ont été vaccinés. Alors, le COVAX demande très clairement dans leur déclaration que les pays riches, les pays avec le plus de doses, les partagent dès maintenant, immédiatement, sans tarder, sans attendre. Et il dit que même si ces pays partagent 1 milliard de doses, qu'il y aura suffisamment de doses pour tous les pays riches pour vacciner 90% de leur population de 12 ans et plus d'ici la fin de l'année. Malheureusement, le Canada a décidé déjà de prendre des doses de COVAX. C'est le seul pays dans le G7 de le faire. Il a aussi décidé de prendre des doses de l'Indian National Serum Institute, qui est le fournisseur de la plupart des doses pour le COVAX. Et on continue de refuser d'indiquer quand nous allons partager des doses avec le COVAX. Ça, c'est un problème, c'est décevant et c'est aussi dangereux. Exactement parce que, d'abord, c'est décevant parce que le plus de doses que le Canada prend du COVAX, le plus de doses qu'on ne partage pas, le plus grand le risque pour les pays pauvres et de moyens revenus aussi. C'est aussi très dangereux parce qu'on sait que si on ne partage pas nos doses, comme le COVAX a dit, qu'on court le risque qu'il y aura des mutations et nos vaccins ne seront pas efficaces contre ces mutations. Alors, concrètement, qu'est-ce que le Canada et les pays du G7 devraient annoncer à leur sommet dans les prochains jours? Ils devraient annoncer un calendrier concret pour assurer qu'il y a un calendrier pour la vaccination globale, pas uniquement dans leur pays, mais global. Et ça devrait être un calendrier pour indiquer combien de gens globalement seraient vaccinés avant la réunion du G20 en octobre. Le Canada devrait annoncer combien de doses nous allons partager avant la fin de juin, comme le COVAX a demandé, et quand nous allons envoyer ces dosages. Je note que ce n'est pas un choix binaire. On peut absolument protéger les gens ici au Canada sans prendre des doses de COVAX et aussi au même temps être des voisins responsables. Hier, quand j'ai parlé j'ai eu l'opportunité de parler avec la Fédération des syndicats d'infirmières et ils parlaient de leur inquiétude pour les travailleurs et travailleuses de première ligne dans les autres pays. Ils parlaient de leur souci que le Canada n'allait pas faire leur part de protéger les gens et de partager nos doses. On sait qu'il Canada, la plupart de nous, nous avons des amis, des collègues, des autres dans ces pays. On veut faire notre part et on sait qu'il n'y a pas de choix entre être responsable, protéger les gens à l'extérieur et à protéger les gens ici au Canada. So the G7 summit that is about to begin in the United Kingdom has absolutely been converted into a global summit on global vaccination efforts. This is the time for Canada and the wealthiest countries in the world to stand and deliver. We know that the COVAX facility, which is the main supplier of doses to poor and middle-income countries, have made it very clear that if they do not receive a massive injection of doses of vaccinations within the next couple of weeks, that the results may be catastrophic. Because we know that the main supplier of vaccines for COVAX has had to deal with a surge of cases in India. And so they have sounded the alarm bell. They have put out a joint declaration and asked rich countries who have cornered the market on vaccinations to please share those doses on an urgent basis. They have said that it cannot wait. They have said that money is not a substitute. They are asking for at least 1 billion doses to be shared in 2021. Unfortunately, Canada to date has done several things that run counter to what we have been asked to do in this global call. First, we have drawn down doses from COVAX, and in the context of the G7, we are the only country to have drawn down doses from COVAX. We have also gone and taken doses directly from the Indian National Serum Institute, which is the main source of manufacturing for doses for COVAX. And we have refused to indicate any schedule at all for when we will share doses with COVAX, despite having been asked at the end of May to provide information about that. This is a situation and a position that is both disappointing and extremely dangerous. It is disappointing because we pride ourselves on being good neighbors. We pride ourselves on taking care of the global community. And as I was participating in the annual meeting of the Canadian Federation of Nurses Unions, I heard the worry, as I was waiting to go on, the worry expressed by members of that federation about the health and the safety of their colleagues in other countries, about the health and the safety of frontline workers everywhere, and of course also about their worries about what might happen if the vaccination effort does not become global soon. Because in Africa, we only have 2% of people in Africa have been vaccinated, have received 1 dose of vaccination at this point. Our stance is also very dangerous because we have heard over and over again by infectious disease specialists, by the World Health Organization, by the Global Alliance on Vaccination and Immunization, that if we do not vaccinate the world at the same time that we vaccinate ourselves, that we run the real risk of seeing the virus mutate into a form that our vaccines will not be effective against. And so as leaders gather for the G7, concretely, what must they do? What must Canada do? What we need to do is to ensure that Canada leaves that meeting having agreed with the other members of the G7 on a specific calendar as to how many people we intend to vaccinate worldwide between now and the G20 meeting in October of this year in Rome. Canada specifically needs to say how many doses we will send to COVAX and exactly when we will send them. And every other G7 country needs to make the same commitment at this meeting. Because there really is no binary choice here. We are protecting ourselves when we protect the world. We have all the ability to protect people in Canada while also sharing doses on an urgent basis. We know that even after sharing this 1 billion doses, wealthy countries will still be in a position to have over 80% of those 12 years and older vaccinated before the end of this year. So let us do the right thing. Let us do the smart thing. I hope that the Prime Minister will be returning from the G7 summit with good news for us all. Thank you very much.
And we'll now take questions, starting with questions on the phone. A quick reminder to reporters, as usual, one question, one follow-up. Nous allons maintenant prendre les questions, commençant par les questions au téléphone. Comme à l'habitude, une question suivie par journaliste. Opérateur, avons-nous une première question?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. Once again, please press star 1 at this time if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. There are no questions registered at this time. Nous n'avons pas de questions pour le moment. I'd like to return the meeting back over to you in the room.
Good morning, Madam Paul. David Thurton, CBC News.
Morning.
It's good to see you.
You as well.
I know you're here to talk about COVAX and your concerns and the G7 commitments you're hoping to see, but with kindness, I just want to ask you about what's happening within your party. Can you tell us what is the status of your senior advisor right now? Is he still working for you?
So with respect, thank you, David, for the question. And with respect, my answer again, I try to be consistent. I say the same thing all the time when I'm asked about these internal matters. And I know that the questions have to be asked, but my answer is always the same, which is that I don't rather discuss internal party matters in the press. If there is something that the party intends to announce, we will do it first with our members, and we will do it through those channels. We are a party that is trying to model a different way of doing politics. I am trying to present a different culture in politics, do my little part and with all humility. And so that will always be my answer when I am asked those questions. We will share whatever information that we feel we need to with our membership first, and then after that, we will make sure that anything else that needs to be shared will be posted on our website.
Just with kindness again, Madam Paul, I do need to follow up because these matters are in the press, they're on social media. I'm getting calls, I'm getting emails. And so if maybe you won't answer that question about your senior advisor, maybe can you speak about what this rift, this turmoil, the things that are happening within your party, what do you think it's doing to your party? What do you think it's doing to your staff, the staff who work for your caucus, for yourself, your volunteers? What do you think it's doing to your party?
Well, it's it's a fair question, and I'm sorry to have added to your work burden. I would say that any party that is committed to making space for a diversity of voices, any party that is willing to be open and inclusive, is always going to have moments where there are differences of opinion, where there are strongly held opinions. My goal, again, to the limit of what is respectful and what allows a safe space for conversations, my goal in this role is to make as much space for those conversations to happen as possible. I don't think that we should be afraid of them. I know that there are reasons that we want to avoid them, but really for the purposes of the strength of our party, for the strength of our grassroots culture, for the purposes of the strength of our democracy, I think it is really important for us to model how it is possible to have strongly held differences of opinions and still be able to work together and still be able to talk about them. If we can model that, I'm hoping that that is a culture that we can help to bring to Parliament. and I'm hoping that if we can bring it to Parliament, it's a culture that we can help to spread even beyond our own borders. So when these moments happen, of course, they are difficult. They can sometimes be painful, but again, we're not going to seek to suppress those conversations simply because it would make my life easier. And it would, I mean, it would, at least in the short term. But I think the consequences to our party ultimately, and the consequences to democracy and participatory democracy would be too high. And I'm not willing to pay that price.
I'll check once more if there is questions on the phone. Operator?
Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. There are no questions registered at this time. Nous n'avons pas de questions pour le moment.
Merci beaucoup. Thank you very much. Oh, sorry. Yes, absolutely, David.
Yeah. You mentioned a couple of things in your response there, Madam Paul. Grassroots, participatory democracy. These are things that the Greens are known for. Also speaking to the media very openly about the internal issues. I could remember your past leader being quite open and speaking to us in the media, whether it was an issue of policy or an issue of internal politics. I guess, why are you taking a different approach? And is this going against, I guess, the ethos and the what the Greens are about?
Again, another fair question. I will be as transparent and open as I can be about our policies. Since becoming the leader, there are a number of initiatives that I have launched in order to make our party more accessible, more transparent. So, for instance, our Time to Run campaign, which is the first time in, as far as we know, in federal politics, that a party has sent out an open call for applications for potential candidates, which has been incredibly successful, setting out exactly how a person can present themselves to run for us. I have also launched an open recruitment campaign for our shadow cabinet, making an open invitation to all of our members and inviting them all to apply in a process that is also completely transparent. I'm going to be here several times every week until Parliament stops sitting so that I can answer all of the questions that I'm asked about our policies and our positions. And so we do want to be an open and a transparent party, but I am not interested in contributing to the culture in politics in general of leaks, of rumors, of innuendo. I'm not interested in contributing to undermining people, ruining reputations, creating division where it does not need to exist. And so when we are speaking in particular about these kinds of issues and making sure that we create a space that is safe above all and respectful, it does require some patience. It does require some discretion so that people can be open and honest. If they think it's going to end up in the newspapers the next day, that's unlikely to happen. So we are going to be as open and welcoming and participatory as possible, while at the same time making sure that our wonderful staff, our wonderful MPs, our wonderful volunteers and members can also feel that they can have conversations amongst themselves without it ending up as a headline. So it's a delicate balance. I recognize that. And again, I welcome the questions. I respect you asking that question. But my answer, as I said, will be the same when it comes to things that really should be internal and resolved internally.
This concludes the press conference. Ici, mes fait la conférence de presse. Merci.
Merci beaucoup.